We'll move on then to number 5 on the agenda, which is Community Safety and Wellbeing Plan, Mel Vero. And I'm sure all of you will find this very, very interesting and enlightening. This is a project that's been going on for some time, and it's very, very germane to the future of the city of Timmins.
Good evening. Thank you. Good evening, Mr. Mayor. Good evening, everyone. I'm very happy to be here, actually, to share with you an interim report as to where we are at with the Community Safety Wellbeing Plan. Is there a way to bring up my... I have to do that on my own here? Perfect. So again, the purpose tonight is to share with you as to where we are at with this plan, and as well as share with you our recommendations for strategic priorities for this first plan of our city, for sure, as it relates to community safety and well-being. So basically what I'm going to highlight tonight is give you a bit of a background in terms of Ontario's community safety and well-being planning framework, as well as share with you the impact of COVID-19 and what that's meant for the work that we have done here. Along with that, I'm going to do a quick analysis. I'm going to talk a little bit about the data that we've gathered and analyzed and share with you some of those highlights, and then finally bringing us to our 2021-2022 strategic priorities. Finish off with some next steps, and then, of course, any questions that you may have for me as we move forward. So in terms of the framework, back in 2018, the Safer Ontario Act mandated that all municipalities must prepare and adopt a community safety and well-being plan. From there, in the Police Services Act in 2019, details of how this is to be done was presented there. However, still respecting the uniqueness of each municipality in terms of how they will put their plan forward. So the Community Safety Wellbeing Planning Framework developed by the province will help to guide municipalities and other communities along with their partners as they develop their local plans. So essentially, it is about moving away from a siloed, more reactionary approach to things and more towards upstream, multi-sector collaborative initiatives. So as you can see from the slide here, you have an image of the actual framework that outlines 4 areas of focus and how we should be aligning with these 4 areas in making our communities healthier and safer. So I'm just going to give you a bit of background in terms of these 4 areas so you have a sense of what I'm talking about here. So in terms of social development, basically we're talking about addressing the underlying causes of social issues through upstream practices and attitudes that promote sustainable individual and community wellness. So when we start with and implement upstream practices, we are capable of addressing multiple issues at the same time with potentially fewer resources that are required. So issues like safety, healthcare, income, housing, belongingness, and inclusion. In order to create a more positive experience for all of us, we need to address the foundational systems and relationships in our society that play a critical role in shaping our environment and experience of well-being. So these are things like shifting our mindset and how we approach service delivery, so from strength-based, family-centered, and of course anti-racist efforts that need to be brought forward in everything that we do. So basically upstream means exactly that, is about stopping a problem before it starts. The next level is about prevention. So it's about utilizing and implementing proactive strategies to locally known and identified risks to community safety and well-being before they result in harm to our residents. Risk intervention is about identifying and responding to situations of acutely elevated risk, also known as AER, and mobilizing immediate interventions in order to prevent a serious incident from occurring, thus reducing the need for incident response. So outcomes here are focused on mitigating harm. Implement immediate multi-sector responses, which we have here in our community, such as our situation table, the violent threat risk assessment protocol that we have with the schools, to address multi-risk factors. So here it's about collecting data that is risk-based. So we do have the risk-driven tracking database available through our local police to get stats in this area here. So to determine the success of, the strategies that we have in this area right now, performance metrics collected may demonstrate, for example, increased access to and confidence in social supports, decreased victimization rates, and of course the number of emergency room visits that we see. And then finally, the smallest circle in the middle in red is incident response that we're talking about here. And it really pertains to those critical and non-critical incidents requiring first responders. So our police, fire, EMS, potentially a child welfare when a child is being apprehended, a person being apprehended under the Mental Health Act, or of course a school principal calling about expelling a student. So many communities invest a significant amount of resources in this area, and although it is certainly very important and necessary to do that, it is also reactive and focuses on output measures instead. So planning should also be done in this area to better collaborate and share relevant information, such as types of occurrences and victimization, to ensure the most appropriate service provider is responding. So successful initiatives include, for example, we have right now the mobile crisis rapid response, the police having partnerships as well with addiction services here in our community. So initiatives alone in this area cannot be relied upon to increase our community safety and well-being. So as you can see on the screen, we certainly do need to do planning in all 4 areas. However, more of our time and resources should be concentrated on the outer circle, so beginning with social development, followed by prevention and risk intervention strategies in order to reduce the number of Timmins residents reaching the point of requiring an incident response. So in terms of community safety well-being planning, it is a community impact long-term tool. There to achieve sustainable communities where everyone is safe, has a sense of belonging, opportunities to participate, and where individuals and families are able to meet their needs for education, health, food, housing, income, and social and cultural expressions. So in terms of our community here and with the work of the advisory committee that I work very closely with, we discussed about reimagining our city and a vision of a healthier and safer Timmins for all. And, basically refocusing our efforts here, existing efforts and resources in a more strategic and much more impactful way to enhance collaboration, information sharing, and performance measurement. So that being said, alignment of our human service system is extremely important in our community. So thankfully, though, and with this work that we've done here, we already see that many of our services have similar overlapping priorities, policies, practices, resources, and outcomes. So accountability for shared commitment can certainly be achieved with the work that we will do together, and of course through developing a systems leadership group or a steering body. So let's talk a little bit about the impact of COVID-19. The city's initial community safety well-being plan methodology aimed basically to complete all engagement events by early May 2020 and use the qualitative data from these activities along with the other gathered data, such as quantitative data, to develop our strategic priorities. As we know, in March of 2020, mandatory restrictions were put in place to protect the health and safety of our community. So the provincial government passed the Coronavirus Support and Protection Act, which enabled the Solicitor General to set a new deadline for the completion and adoption of community safety being plans past the original deadline of January 1st, 2021. The amendments came into force immediately upon royal assent, as we know, and this change will certainly help ensure that we, along with other municipalities across the province, are able to meet the legislative requirements and complete our plans with new required timelines. and which will be set by regulation, I expect, at a later date. That still hasn't been announced yet as to when that will be. This extension will also ensure that we, along with other municipalities, police services, and local service providers, can continue to dedicate the necessary capacity and resources to respond to COVID-19 pandemic, while also providing adequate time to effectively undertake consultations, work together with our partners, and develop meaningful and fulsome plans following the provincial emergency. So in response to such, a revised approach to engagement was developed. So scheduled public consultations, we had 6 in total scheduled across our city, from South Porcupine, all corners anyway of our city, along with community stakeholder focus groups. I had 7 left to complete. Were converted to either online sessions or deferred to a later date. In addition, the deadline of our public survey that was launched back in March of 2020 was now extended to May. So a communication regarding such was brought forward via social media platforms and, of course, on our landing page that's found on the City of Timmins website. The ongoing COVID-19 situation reiterates once again the importance of a thorough and proactive community safety well-being plan to support our community by responding to current and changing priorities such as those seen during the recent COVID-19 situation. So in terms of our data compilation and analysis, when we think about what we are doing here, a few different avenues have been taken to gather qualitative data, aside from the quantitative data that I've mentioned a little bit more recently. In the interest of being effective and efficient and holistic, both quantitative and qualitative data collection methods were utilized to compile data for our first Community Safety Wellbeing Plan. All gathered and compiled data for this plan have been completed in a way and for a purpose that is consistent and complies with, as well as respects, freedom of information and privacy protection legislation. Information gathered through the engagement process is at the core of the recommended priorities for this plan. Other data resources such as asset mapping, environmental scanning of our community-wide programs and initiatives, as well as quantitative data collected from multiple sources, provided supporting information to validate the recommended strategic priorities. So in terms of asset mapping and environmental scanning, to give you a bit of an idea, in terms of what we have going on in our community. So some of our community-wide initiatives that span across, again, a number of different organizations, programs and services include the following, but not limited to these groups. The Age Friendly Advisory Committee, the B-City Committee, Cochrane District Mental Health and Addictions Planning Table, Community Mobilization Committee, which is our situation table, along with their own steering committee, our Crown Ward Education Committee, l'équipe communautaire d'évaluation des menaces, so again, the violent threat risk assessment model, our FASD Awareness Cochrane Timmins Coalition, First Nations Healthcare Transformation, Healthy Child Coalition, High Risk Offenders and Domestic Violence Committee, Human Services and Justice Coordinating Committees that span not just locally, but all the way to the province, Justice System Service Committee, Mobile Crisis Rapid Response Team, Moving On Mental Health, Northeast Regional Local Aboriginal Health Committee, Needs-Based Planning for Mental Health Services, Pride Timmins Committee, Regional Mental Health and Addictions Council, Timmins and Area Drug Strategy, so TADS, along with their own steering committee, Timmins and Area Victim Services Board, Timmins Executive Directors Group, Timmins Police and Local High Schools Principals Committee, Timmins Violence Interagency Action Committee, and our Timmins Recreation Trail Committee. So just those are a few of the things that are going on community-wide here that many different service providers are involved with. And of course, a little focus on what's happening here at the city in terms of initiatives and activities. We have, for example, the Anti-Racism Action Program, the Bilingualism Policy Advisory Group, Community Consultation on Trail Use and Recreation, the City of Timmins Emergency Management Program Committee, Indigenous Advisory Council, Rural and Northern Immigration Pilot Group, and Violence Against Women Committee. Along with that, certainly the advisory committee provided a lot of input into our direction here. And along with that, I should mention that the Act does require that each municipality appoint an advisory committee for the development and implementation of the plan. So the advisory committee must consist of a number of members from different organizations. So this multi-sectoral collaboration is a key factor to the success of this planning, as it ensures an integrated approach to identifying and addressing local priorities. All of the advisory committee members must have expert knowledge and experience with their sector, as well as the local vulnerable sectors, real-time experience dealing with community risk factors, and a history of advocating for vulnerable populations through work and or other advocacy efforts. In addition, all advisory committee members must have knowledge and understanding of the other agencies and organizations within the community and be able to leverage their expertise if required. So in the formation of our Community Safety Wellbeing Plan Advisory Committee, the preceding guidelines were fully respected, if not more. So maybe just to say a little bit about this really amazing group that I had the opportunity to work with. A very diverse, knowledgeable, authentic, and engaged advisory committee was formed in the fall of 2019 and persevered in developing the four priorities that we have here for our Community Safety Wellbeing Plan. To achieve this, the advisory committee met on a monthly basis to review, assess, and discuss gathered data, among other things. And once the final plan is going to be approved, this group will transition into a system leadership committee, who in turn will steward the ongoing implementation of our Community Safety Wellbeing Plan and direct our model for collaboration, planning, and action. So this committee continues to play a fundamental role in the first ever Community Safety Wellbeing Plan for our community. And during and in between even our meetings, these members have provided strategic advice, consultation, and feedback into the fruition of our strategic priorities. I also did a bit of a study across the province, as well as had the opportunity to be part of a provincial working group. So I took some time to research in terms of what other communities had already posted for their community safety and well-being plans, as some communities were actually the pilots for this model. So in terms of reviewing that, looking at their processes, how they gathered their data, implemented their priorities, and as well as how they measured performance were some things that I looked at. And with the provincial consultation group with other lead coordinators, it gave me the opportunity to validate where we are at and also get some advice from them and consult with them about the development of our own plan. And probably the most important one on this is our community engagement process, which was certainly a very wonderful opportunity for me. I still have to say I'm certainly very fortunate to have had this opportunity to meet with such amazing people in our community, and wish I would have had more time to do a little bit more. But the engagement process provided an opportunity for community stakeholders to share their input as to guarantee that our first community safety well-being plan responds to and aligns with the needs of the residents of our community. The community engagement process spanned for the most part before the first wave of COVID-19. However, during and after COVID-19, as I mentioned, additional engagement activities did take place, including some focus groups, our survey extended, and more recently, the development and implementation of an action table and a community-wide communication strategy known as Timmins.CARE. So it is important to note that COVID-19 did not allow for engagement opportunities with a few of the key stakeholder groups due to their busyness with COVID-19 situations. But it's hoped that we will have the opportunity to sit down with them and get some of their input, or at least involve them in the strategic priorities implementation. So from December 2019 to about July 2020, 40 engagement sessions were completed. And it gave me the opportunity, like I said, to hear from a number of different people. So 512 personnel members, to be exact, from 37 different community service organizations, ranging from frontline staff to management, board members, volunteers, 25 youth from one French high school and one English local high school, ranging from grades 9 to 12 in mainstream as well as various pathways programs, 14 seniors from 2 local seniors residents, and 20 resident interviews. So these were individual face-to-face or telephone interviews that I completed with local residents with lived experience. So they've identified themselves as either being white, Indigenous, living with addictions and mental health, living in poverty, without housing, Francophone, 2SL, seniors, immigrants, women, and youth. So I just wanted to maybe share with you in comparison to some other communities. For example, the city of Ottawa, which has a population of almost 1 million people, they met and heard with 630 stakeholders. So an online survey was developed and launched to community residents in order to gain, again, more information and get their assessment, as well as how they perceive and consider top priorities as it relates to community safety and well-being. So between March and May, as I mentioned, the survey was launched. And with that being said, a total of 814 respondents participated in and completed the survey. And again, in comparison to Ottawa, they had 1,600 respondents participate in their survey, knowing that they are a community of 1 million people. So once gathered and assessed, all feedback from the community engagement process was summarized. Highest counts indicated a general theme of interest for this data set. The analysis identified other topics that did not fall within the established list of community safety and well-being topics for consideration. But based on this preceding data and analysis, the ranking of topics are outlined as follows: housing, mental health and addictions, personal safety, criminal involvement and activity, long wait times to access services, particularly for youth, food security, poor judicial consequences, ability to navigate systems easily, discrimination, marginalization, lack of resources available to manage personal situations, community infrastructure in general, from roads to lighting to green spaces, that sense of pride in our community. Increased prevention and early intervention programs, specifically for youth and children. Social support network and isolation, social isolation for youth and seniors. Education, employment, seamless service delivery again came up. Expanded prevention programs that address social issues, healthy neighborhoods, addressing needs of newcomers in challenging times, and lowering cost and free recreation activities. So the above mentioned priorities stemming from the community engagement process data results were then combined with the rest of our data, and the analysis was then taken to consult with our advisory committee, presenting them these findings, which in turn brought us to our recommended 4 strategic priorities. Specifically, much of the gathered quantitative information, just so you know, validated the preceding results that I just shared with you. In sum, the compilation and analysis of data from the preceding methods clearly confirm the intricacy, the complexity, and connection between current issues. Furthermore, the data reinforces the fact that community safety and well-being issues are shared responsibilities among all citizens residing in our community, and thus require an accountable, integrated, and collaborative approach, not only to tackle root causes via immediate and relevant actions, but also to focus on long-term and upstream best practices. So the recommended 4 strategic priorities for our city will address the most urgent root causes of safety and well-being, as noted by the respondents to our engagement activities, as well as other key data compilation and analysis methods. I strongly believe that by realizing these 4 strategic priorities, other aspects of community safety and well-being in the city of Timmins will benefit. So other aspects meaning other issues that are on the radar, certainly not far from us, that could be addressed by even just addressing these 4. So here we go for a moment. In terms of what we are talking about with our 4 strategic priorities, and these are not configured in any specific order, just so you know, in terms of which one is the priority. So in terms of the top one, the unified and innovative community system approach to end homelessness. Certainly this is really about structural and systems prevention frameworks that can certainly deal with our current situation, early intervention via coordinated outreach services and prioritization, focus on housing and quick emergency shelter exit, as well as, of course, some data to measure our progress on this area. So ending homelessness is key to ending poverty, as we know. Off to the left, we have the harmonized mindset in action to improve care, respect, and outcomes for addictions and mental health. So this is basically seamless, equitable, accessible, integrated, and effective care for all. Public investment framework for systemic change. So again, prevention, literacy, overcoming stigma, inspiring hope, and creating a network of support. Upstream, and again, prevention interventions via coordinated and innovative efforts of key service providers. Coordinated efforts at all levels of government, as we know, to address the local crisis and advocate for upstream impact. And again, certainly about developing a data stream that will measure mostly recovery. So when we think about, again, upstream thinking, it certainly is a must for us to look upstream toward the beginning to understand why this is happening in Timmins in the first place and how together we can change our situation for the future. Over to the right is the youth-focused community, a youth-focused community aiming to improve well-being, inclusivity, resiliency, pride, and success of all of our youth. So basically this means youth involvement in community programs, initiatives, and decision-making that impact them. Accessible, inclusive, equitable care and safe and affordable programs and opportunities related to education, to health, transportation, and employment. Youth-friendly spaces as well that meet the expectations of youth and their needs while improving the social, mental, and physical well-being of youth. And of course, data, both qualitative and quantitative, here to measure the outcomes, report on progress, and share recommendations. We know that for youth, education can create better opportunities for their overall health and well-being. And finally, at the bottom, we have the shared responsibility and effort to improve safety and belongingness of all residents while in their homes, at work, and in the community. So basically, we're talking about here about transforming current thinking and practices regarding root causes of community safety, local risk and protective factors, and articulating actionable roles and responsibilities. Educate on the shared responsibility for community safety across sectors, including prevention, intervention, and enforcement initiatives. Dedicate resources and activities to community safety in Timmins downtown, recognizing it is a space for all residents to share, to visit, and prosper. Promote awareness of a sense of citizenship and an opportunity to build community capacity and leadership. And provide local schools, for example, with community safety tools. Same idea here about data collection to measure outcomes, to report on progress, and share recommendations. So we do know when it comes to a priority like this that community engagement and empowerment are critical to strengthening public safety. So these proposed strategic priorities in this model for our first plan includes the guiding framework, as you can see, in terms of the 4 areas of focus that need to be integrated, as well as an integrated community-friendly systems navigation component that you see right at the center of that model. And it's this component that will support and integrate actions undertaken within these 4 strategic priorities. And that was actually a constant theme mentioned by respondents as a gap within each of the other top priorities is a lack of integrated and simpler systems where community services work together as one team, making services more accessible, more seamless, and streamlining the system for everybody using it. The city has no shortage of social services, as we know, ranging from child and family services, mental health, addictions, counseling, women's services and shelters, Friendship Center, Children's Treatment Center, resource centers, and senior services, to just name a few. But with the number of services found within our city limits, the challenge always remains that there are currently limited opportunities to communicate system-level barriers that negatively impact residents who are vulnerable, at risk, and in need. Despite that, Timmins has many target population-specific issue and planning committees and groups. Currently, there is no mechanism to respond to a wide range of community safety and well-being issues and trends in a collaborative, coordinated, and integrative manner. Hence, the need to focus on and bridge the gaps found in the city's human services system will not only impact vulnerable residents in a positive way, but also decrease emergency and crisis-driven responses and services. Integrated and simpler systems is about how organizations work together to deliver their programs and services, and includes the communication, processes, policies, and finances needed by organizations here in Timmins for enhanced collaboration, planning, and action. A culture shift is required to address systemic issues, remove obstacles and silos amongst community organizations, resulting in increased community partnerships and more effective and efficient delivery of programs and services. Now, our guiding principles that are not noted on this picture here for our strategic priorities that is woven in to all of our priorities are the following 6. Community-centeredness, shared accountability, upstream investment, inclusive excellence, transformational practice, and asset-based approach. I'm almost done. In addition, an identified systems leadership group, as I mentioned, the committee that was once the advisory committee will then become the system leadership committee, is going to be comprised of our key leaders from organizations within the community that are accountable to and have the capacity to innovate and address system planning in the human services systems, play a critical role in the success of our city's plan. This leadership committee will have a broad mandate to assess progress as well as identify system gaps as they relate to the 4 strategic priorities here, as you see. Issues will then be prioritized and addressed primarily by current established and new action tables or task force, as you can see below here on the screen. These task force or action tables will respond to the emergent issues as well as certainly look at the long-term planning. It's important to mention that if an existing body is already well positioned to address one of these 4 issues, the group may be asked to assume the role of an action table or task force. And that's currently in process right now in terms of looking to see if there are other committees right now that can take on one of these one of these strategic priorities. Of course, you can see the municipality is listed there at the bottom and all the way across, and that's because the municipality has the role of being the champion of this plan, and not only to be a conduit of knowledge and information, but also a leader and an advocate in this plan's execution. In addition, the city will be tasked to assist with future funding, as well as to develop partnerships and collaborate with other key community resources in seeing this plan through. Such entails that the City of Timmins may have some actions, but will not assume full and sole responsibility for the implementation of this plan. Furthermore, the recommended strategic priorities were identified as both the most important to community stakeholders, as well as the most effective to address current concerns in the first edition of our plan. Given that the plan is both a foundational and a long-term strategy that aims to address existing community-wide safety and well-being issues, it is intended to be a living, adaptable, and proactive document that can respond to emerging trends and concerns as they arise, as well as open the door to new strategic priorities for our community. So just the last piece to mention in regard to our next steps, and as I mentioned earlier, because of the impacts of COVID-19, we've had to kind of reassess our methodology about moving forward. So certainly in terms of moving forward, as per legislation requirements related to mandating community safety and well-being planning, municipalities, again, have to develop performance measures for their respective plans, and that performance being monitored accordingly. So in consultation with the advisory committee, and myself, along with the leading tables once they're going to be formed, we will develop an evaluation plan and performance measure plan for all of these 4 strategic priorities. In terms of implementation, the implementation plan sets out how each action strategic initiative will be executed. So all of the leading action tables of these 4 strategic directions will be responsible for the implementation details for their actions and initiatives aligned with their respective strategic direction. So again, key items for them to consider will be things like a proposed governance structure to administer the implementation plan once it's been approved, develop a clear timeline, action plan that aligns with that strategic priority, a schedule for future reporting to the systems leadership team or committee on progress of their priority implementation plan, and of course any human resources requirements, financial requirements to implement the proposed actions. And in terms of the final plan, again, I've given you a lot of intel here today, but certainly the final plan, aiming to have that completed by the spring, as I anticipate that our extension will be at least to March 31st, 2021. The final piece will certainly be, maybe just to mention about the final plan, I've certainly been in consultation with a couple of different youth organizations and lead reps of youth organizations to see if there's some appetite for the youth to help me finalize the plan. So with some artwork, with some, I guess, some graphic designing, which is not my forte. So it'll be good to have these young minds helping me with that piece and putting their own little spin on this as well. So again, that will be when the final plan will be done here for presentation to council. And lastly, just the communication strategy. Currently, as we know, we have Timmins.CARE, which I hope that community safety wellbeing will occupy a place on that website, along with a communication strategy to the community to share with them details of this plan as we move forward. And that's all I have for you. Thank you so much. Merci beaucoup. Miigwech.
Comments? Councillor Marks.
Thank you very much. It's a lot of information. But I was going to ask you two questions, and one of them was about what was the gleaming priorities which came out, and you clearly identified that, and it's kind of top of mind right now within our community. Right. The second one was about the youth involvement, and it's I'm really glad to hear that you've been in touch with the youth and that they're working with you, because I know that's certainly a foundational point for our community to grow off of. My one then, which you've answered those two questions. So the last one, if I have a burning desire to get in touch with you, can I, in the way of a community member, be in touch with you? Or are those, has that door closed?
To share more input?
Yes. Mm-hmm.
No, absolutely, for sure. There could be opportunities to do that. And again, the place that we do have on our landing page, there's information there, certainly that they can bring forward. I'm going to tell you that I do get stopped anyway in my tracks by community members or getting phone calls by them as well directly. So I'm glad that people feel comfortable to come and talk to me about this initiative as well, or at least, connect me with people that would like to share their stories. So that's been wonderful as well too. But certainly when we launch the communication strategy, my hope is that there will be a place where people could reach out to an email address, whether it is asking questions or sharing information, bringing up any issues that we can then disseminate and be have this and bring it to the right table. Certainly.
Okay, thank you very much.
You're very welcome.
Solid work.
Awesome. Thank you.
This is a phenomenal report. I think we've talked about it a few times, and I've said it's a very enlightened piece of legislation. My fear was that, in fact, it might sit on binders on shelves, and we can't afford that. But you clearly indicate that this is evidence-based. It's driven by data that's measurable and therefore can be reported back. Most importantly, it's designed to break down all the silos so that the community actually works together from the school boards right through these agencies. It's designed so the target in the middle that's red, where in fact we've had an incident with the police or anybody else, we already know we failed as society there. We already know that's primarily where the resources are focused. But it finally breaks this out of that laissez-faire type of approach to active engagement with everybody within the community. The doctors have already told us that our situation over the last 3 years has changed dramatically. And a critical part of this, of course, one of the critical pillars of our community is this community safety wellbeing plan. And I'm so happy to see it reported like this. I'm excited to be a part of this reporting mechanism, this philosophy, if you will, because it really changes the dynamics of how we integrate and engage our citizens. Absolutely critical if we're going to develop and grow our community. I think it's a phenomenal report. I congratulate everybody that's been a part of this. Part of this, of course, tomorrow we'll have a media release on Timmins.CARE, and we'll have an open Zoom conversation at noon hour to talk about Timmins.CARE, which is just one part of this whole thing. We're just extremely fortunate that we have leaders within our community like ourselves, Mel, and the team that you're working with, that drive this forward. Very pleased with that report. Thank you very much.
Thank you, sir. Thank you.